almost 4 years ago, Roe versus Wade was overturned. And in the wake of that, we have over 12 states in the US that have banned abortion entirely. And what that means, of course, is that it is criminally regulated. And right here in Texas, the potential penalty for a doctor or provider or friend or family member who helps someone access abortion in the state of Texas is up to 99 years in prison. So these criminal laws are creating havoc on the lives and the health of women in this state, but also in other states in the United States. And I also want to say, though, that while Texas is perhaps the ground zero of restrictions on access to abortion care and its attendant problems on a whole range of reproductive health care issues, there are other states that are standing tall and standing proud and really being beacons for what it means to have good, strong reproductive health policies. And let me just say, when we're talking about reproductive health, we're not just talking about abortion. We're talking about maternal health. We're talking about access to contraception. We're talking about access to fertility care, including IVF. And so it's really about the whole arc of reproductive health and life over the whole arc of a lifetime. So with that, I want to get to talk about those states, which I think you've called California a safe haven for reproductive rights and access to abortion care. We are really glad to be joined by Attorney General Rob Bonta, who has been the Attorney General of the state of California for 5 years. Prior to that, in the California state legislature. Prior to that, a city attorney in San Francisco. So a life dedicated to the public interest. And let me just start by asking you, what does it look like for a state to protect reproductive rights? Constitutional matter as a matter of public health policy.
Great. Well, thank you, Nancy, for having me. Thank you all for being here for this important discussion. Super honored to be the Attorney General of the great state of California. If you keep me here too long, I'll keep saying things like California is the largest state in the nation, the fourth largest economy in the world, the state where a phrase has been created for us, as California goes, so goes the nation. And we take that very seriously. And I was the Attorney General in the wake of the Dobbs decision, devastating and painful. And in that moment, I and the governor and our incredible partners in the advocacy space all sort of came together to determine what our response would be. And the answer to your question is we use every tool in the toolbox, whether it be legislation, budget, litigation, the bully pulpit, and at every level, whether it be state, federal, to advance and make real the idea that we are a safe haven for reproductive health care, for abortion. No matter who else does what, we will be a safe place where you can get a safe abortion, a legal abortion, the full panoply of reproductive health care services. And right after Dobbs, a council was created called the FAB Council, the Future of Abortion, to advance legislation that increased access to reproductive health care, that put more budget and funding into reproductive health care. We passed a proposition through direct democracy, a statewide ballot initiative that enshrined in our state constitution, no matter what future state legislatures do, the right to contraception and the right to an abortion. And so I believe that my job was to be part of those efforts and to enforce the law and make sure that people knew that these laws weren't just on the books gathering dust, but they mattered in people's lives. They increased freedom, they increased access, they strengthened your rights. And so my goal has always been to do everything in my power, use the full authority of my office, the full extent of the law to enforce these laws and make sure that people in California know they can always get a legal and safe abortion. And that is true in the environment of federal retreat, as we've seen, whether it's the federal administration saying we're not going to enforce EMTALA. Abortion care is emergency health care, and they're refusing to be as engaged in that space as they should. They're undermining access to mifepristone. They're not enforcing the federal FACE Act, which provides safe access to clinics. And we have opposed them in all those areas. We have our own California FACE Act, which we have declared that we're going to be enforcing. We have our own Emergency Services Act, which we have enforced, including in our own state. California, as deep blue as it is, as committed as it is to reproductive health care and to abortion access, is not immune from attempts to undermine it. We have a lawsuit right now with a hospital that has unfortunately had a tragic incident where an individual who was pregnant and needed emergency health care in the form of an abortion because of the danger to her life was refused that care. And while she was hemorrhaging, was told that she should go to a community clinic down the road and was given towels and a bucket for the car ride in case something happened. Devastating and unlawful. And we sued in that case. We also had the city of Beverly Hills and Los Angeles, which got in the way of a healthcare clinic being established in their city. We've gone after so-called crisis pregnancy centers for advancing so-called abortion pill reversal, and which is an experimental and unreliable and unsafe protocol. We have been told, we have reached out to entities that are responsible for executing and implementing the law, like jails and prisons, which are required to provide access to reproductive health care, and to hospitals that are required to provide implicit bias training to address the maternal mortality and maternal health care crisis. And we found, unfortunately, that less than 20% of the hospitals were complying and less than 10% of the jails were complying. But when we got involved, when they knew someone was looking and someone was going to hold them accountable, those numbers spiked to 80% plus and 90% plus. So we try to do it all. We've also issued guidance that pregnancy loss should never be criminalized. And so there were some district attorneys in the state of California that needed to hear that, and that were in the process of prosecuting those who suffered pregnancy loss. So that's a whole span of things that we get involved in, and that's what we try to do. We try to show in all the ways, in all the places and spaces where we can get involved, that we are fully committed to the constitutional right of access to abortion, to reproductive health care, and to the proposition that California will always be a safe haven where you can get a legal and safe abortion.
Thank you for that incredible leadership across a whole spectrum of issues, even within the state of California.
Thank you.
I want to just ask you one follow-up about important legislation that California passed in the wake of the reversal of Roe versus Wade, and that's the SHIELD law in California. Center for Reproductive Rights represents a doctor, Dr. Coito, who's been accused in 2 lawsuits, including one by the state of Texas, of providing medication abortion to people in the state of Texas. There's also a warrant for his arrest from the state of Louisiana. Tell us about California's SHIELD law. What does that do? And particularly, what is happening right now for Dr. Coito because of it?
Sure. It's part of being a safe haven. California being a safe haven for reproductive health care and legal and safe abortion means that people in California can't be prosecuted for seeking care or providing care that is fully legal in California, and no matter what another state thinks. And we've created a number of different protections, SHIELD laws, to help manifest that idea, that commitment. And it looks like a lot of different things. I supported a bill which prohibits tech companies who receive out-of-state subpoenas from responding to them.
Wow.
If it has to do with something that is fully legal in California. The governor will not extradite when requested for someone who is engaged in an activity that's fully lawful in California, even if another state feels that it's lawful. We have protection, or unlawful. We have protections from civil liability as well. So it would be cold comfort if someone came to California and we promised that you could have access to legal and safe abortion, and California honored that, but other states would still find you civilly liable or criminally liable, and that we would participate in those efforts. So we don't participate. Our law enforcement is prohibited from engaging in criminal investigations and prosecutions into someone who was engaged in providing or receiving healthcare that's fully lawful in California, even if it's not elsewhere. And we've been working with you, and so is the governor, to make those SHIELD laws a reality.
Well, thank you very much for that. And I want to bring into the conversation Charles Johnson, who is the founder of For Cura, For Moms. And this is a nonprofit dedicated to improving birth outcomes. And in 2016, Charles had a tragic loss of his wife in connection with her reproductive health care. And I'm going to ask you, Charles, to share with us what took you on this journey to now being an advocate for reproductive health care.
Yeah, sure. So first of all, Nancy, just thank you so much for having me. This is such an important conversation. I'm truly honored to be a part of it. Thank you, gentlemen, for being here as well, and to the entire team that's worked tirelessly to put this together. I'll just kind of start the story at the beginning. I was fortunate enough to meet a woman that absolutely changed my life. And so when we talk about my wife, Kira, we're talking about sunshine personified. We're talking about a woman that raced cars, that had her pilot's license, that, spoke 5 languages fluently. And I know y'all kind of look, yeah, she was out of my league. Let's just talk about the elephant in the room. Rob, I'm just gonna be real with you. So, I always wanted to be a dad. And, we welcomed our first son, Charles V, in 2014. And then we started talking about how cool it would be to have these back-to-back boys. And so when we found out, Nancy, that we were welcoming our second son, Langston, in 2016, we were over the moon. And so we'd recently relocated. We chatted about this earlier, from our home in Atlanta to California. And the painful irony of what I'll share with you this afternoon is we were intentional about seeking healthcare at Cedars-Sinai in Los Angeles because we thought that it was the place that would give us the best chance to thrive. So on April 12th of 2016, we walked into Cedars-Sinai Medical Center for what we expected to be the happiest day of our lives, and we walked straight into a nightmare. We went in for what was supposed to be a routine scheduled cesarean at our doctor's recommendation. We went in for Langston's delivery at 2:00. Langston was born super healthy, 10 fingers, 10 toes, handsome, looking just like me, right? This is it. This is it, on top of the world. And so they take us back to recovery, which is normal in a cesarean. And as Kira is there resting, and as Langston is there in the little toaster incubator thing resting, I'm just soaking it all in, all that pride of being a father for the second time. And as I'm watching Kira rest, I begin to see blood coming from her holy catheter at her bedside. This is around 4:00. I bring it to the attention of the doctors and the nurses at Cedars. They come in, they examine her physically, they take her blood, and order a couple of other tests, as well as a CT scan or a CAT scan that was supposed to perform stat. So when I say stat, what does that mean for everybody? That means right now, right? And so at this point I'm thinking, my wife is healthy, my baby is healthy, and we're at Cedars-Sinai. Those are around 4:00, 5:00 comes, no CT scan. And I'm saying, look, well, where's the CT scan? Saying, so, it's coming. 6:00 comes, no CT scan. Continuing to ask, continuing to push, her blood work comes back and it's showing that all of her blood levels are normally low. She's sensitive to the touch. She's in extreme pain. So there's very clear signs very early on that she's hemorrhaging significantly internally. 7:00, no CT scan. And by this time, Kira's shivering uncontrollably because she's losing so much blood. 8:00, 9:00. I'm still asking more and more adamantly, where's the CT scan? What's going on? They're saying, we may take her back to surgery. We may, and they're just this game of dismissal and denial, and very importantly, deprioritization of my wife's symptoms and our concerns continues to escalate. Now, around 9:00, the only thing that they've done up to this time is give Kira IV fluids. Around 9:00, a nurse comes in to change her IV fluids, and out of desperation, Nancy, I followed her outside, and I just grabbed her by both of her hands, and I just instinctively said, look, my wife isn't doing well. They said they might take her for a CT scan. They said they might take her back for surgery. Nothing's happening. Can you please just help us? At which point this nurse snatched her hands away from me, and she uttered words to me that still haunt me to this day. She said, sir, your wife just isn't a priority right now. Your wife just isn't a priority. 9:00, 10:00. 11:00, we're still there asking, advocating, begging for them to do something. It wasn't until after midnight that they finally made the decision to take Kira back to surgery, after going in at 2:00 in the afternoon for the delivery. So she had been allowed to bleed and suffer needlessly for more than 10 hours while myself and my family begged and pled with them to simply do something. And when they took Kira back in the operating room and they opened her up, there were 3 liters of blood in her abdomen, from where she'd been allowed to suffer for all those hours. They worked on her for some time, but they were unable to save her. And I'm always transparent about the fact, it's crazy to think about this. I've been on this journey for almost 10 years. I'm always unapologetic about the fact that when I walked into that hospital that afternoon, the thought that my wife would not walk out to raise her sons, it never crossed my mind, right? I thought that I'd done everything right. I never missed a prenatal visit, right? I toured all the hospitals. I held her hand through Lamaze class, and it wasn't enough to make sure that my wife lived the full, beautiful life that she deserved. And we'll spend some time talking about the data and the statistics. But what I want you all to understand when we talk about not just the statistics around maternal health, around reproductive justice, around all these families that are impacted, and you're going to hear from one of the best in the business when they talk about the data. But what I want you to understand is that there's no statistic that can quantify what it's like to tell an 18-month-old child that his mother's never coming home, right? There's no graph or no matrices or some algorithm that can begin to compute what it's like to describe to a son that will be 10 years old next month and has never known his mother just how amazing she was. And so we have work to do. And so I would not be here if I didn't believe with every fiber of my being that we can fix this. And so we founded this organization, For Cure for Moms, with one clear goal, and that is to not just improve maternal health outcomes, but to eradicate the maternal health crisis in the United States, period, full stop. And so just a couple of points I want to make is that right here in the United States, we are the most dangerous country in the civilized world to give birth in. Mm-hmm. African-American mothers are dying 4 times as often as their Caucasian counterparts. But here's the data point that I want you to think about on your ride home. Think about when you go back to your prospective corner of the worlds. The CDC has determined that 84% of the maternal deaths in this country are considered preventable. What that means is 4 out of every 5 mothers that we are losing should be here, right? They should be here at the first day of kindergarten. They should be screaming at the top of their lungs on Saturday afternoons at soccer games. They should be at graduations. They should be dancing at weddings, and they deserve to grow old and be grandmothers, and they're being taken from us. And then very importantly, I want you to understand that at the end of the day, if we are in a country that is forcing mothers into pregnancies and taking away their right to choose, the bare minimum you could do is make sure that they survive, right? And so we have to talk about the correlation about the entire continuum of reproductive justice, reproductive healthcare in this country, because you can judge a country by how they treat their mothers and their babies. And if you truly want to make America great, making sure that mothers and babies survive is a wonderful place to start.
Well, thank you, Charles, for sharing that. And, you know, people think, well, this is just one case of medical malpractice. But as you're saying, no, it's a systemic problem, because there's no reason that one of the wealthiest countries in the world has the worst rates for maternal health. And one of the things at the Center for Reproductive Rights, it's probably 15 years ago, we brought a lawsuit against Brazil with the unnecessary death of an Afro-Brazilian woman when she was pregnant. And we were able to establish in that case that, no, it's systemic government failure that led to her death. It wasn't a just one-off, so sad, too bad. It was medical malpractice, but actually a fundamental gender-based discrimination against her. So thank you. And I think we'll get back to talking about some of your policy issues. I want to we'll bring in now some data into the conversation. We have Professor Jason Lindo, who is an economist at Georgia Tech, where he's done research on the economic effects of reproductive health policy. And so what are you seeing in the data, Jason, about what reproductive health policy states have, and what is an economist doing anyway, studying this?
Sure. Well, thanks for having me, and I appreciate the opportunity to share my research. Charles, I appreciate the reminder as an empiricist that underlying every data point that I might be analyzing, statistically, there's a person with a family and who's doing the best they can for themselves. And I think folks can sometimes lose sight of that. So my recent research is on the effects of abortion bans. And for some context for that research of mine, I think we might have a slide.
Oh, we didn't get to.
Okay. I was supposed to show those before I talked, but that's how it started, y'all.
Let's make sure
We'll come back to
let's
that.
make sure that people can see them. So we'll take a pause for a moment on the data because you brought these beautiful
I'm sorry.
photos to
This is
share with us.
so real quick. This is Kira. This is a couple of weeks. I apologize, man.
No.
So this is just literally about 10 days before we welcome Langston. Of course, you'll see how there's a misconception we think about the women that we're losing, that they are coming to pregnancy with a lot of complications, that they're not healthy, that they weren't diligent about their prenatal care. And you'll see just how vibrant and healthy and full of that joyful anticipation. So this is her and our older son, Charles, literally about 10 days before Langston's delivery. Hey, Bubba. Charles, you like the windmills? And then so this next one is we just kind of talk about just literally this journey, how it started. This is I think probably the second day I brought Langston home from the hospital, and so I've got this newborn, and I was trying to figure it out. And then that's both of them just sleeping, and of course Langston was waking up every couple of hours because he was hungry. The older one was waking up because he was missing his mom. And then, like I said, at the end of the day, I'm very fortunate because these two little guys saved my life. And then the next one is this is now, yeah. So this is them. Yeah, it's never a dull moment, man. Never dull.
That's awesome.
Thank you.
Back to the data.
Back to the
data.
So as I was saying, I've been doing research on the effects of the abortion bans that went into effect after the Dobbs decision. And for context, a lot of people say they don't want to live in states that have banned abortion. So 62%, this is a survey by CNBC of 1,000 people aged 18 to 34. And so as it says here, 62% of people say they definitely would not or probably would not live in a state that banned abortion. 45% say they would definitely reject or probably would reject a job offer from an employer in a state that has banned abortion. So as an economist, I do value what people say, but I also really care about seeing what they do and what happens to them. And so with some co-authors, in one study, we looked at US Postal Service data. If you've ever filled out a change of address form to have your mail forwarded after moving, you might be in our data. And we analyzed these data to see what effects actually were realized as a result of these abortion bans when it comes to migration. What we found is that in the year following the enactment of these bans, 128,000 people moved from states with bans to states that had maintained or protected abortion rights. We also saw quarter by quarter, this effect grew over time. And we also found that the effects were concentrated among what we would expect to be younger individuals. 2/3 of the effect was driven by single movers as opposed to family households. So the next question that we asked after this study was, are there any ripple effects on market-based outcomes? Especially as an economist, market-based outcomes, prices, quantities, things like that are things that we're typically interested in. So we looked at the real estate market. We used data from Zillow Research, so anyone could download and analyze these data if they want. And we compared trends in rental prices in states that banned abortion relative to rental rates in areas that were very, very similar, but which maintained or protected access after the Dobbs decision. And you can see it here, clear as day. I mean, you don't need a PhD to see that they were tracking each other super closely, and then there's this abrupt and significant divergence in rental rates. And so, of course, we have lots of bells and whistles. We do fancy econometrics in the paper to make sure that we're identifying the causal effect and we're not picking up something spurious here. Ultimately, what the data tell us is that over this 3-year period following the Dobbs decision, rental rates in states that had banned abortion fell by 2.2% on average. That effect also grew year by year, ultimately reaching 4% in the most recent year of data. We followed that up. We also looked at vacancies. It shows up in vacancy rates as well. Folks with apartments for rent are having a harder time filling them in states with bans as a result of those bans. We also see these effects in other types of housing. So there's a consistent story here that's emerging that not only do people say they don't want to live in states with abortion bans, but it's actually altering where people are living in a significant enough way to move, a lot of people and to shift market-based outcomes.
Can I ask you how you came to do research in this area to begin with? I assume it's not a big research area for a lot of economists. And how did it become an area that you looked in for research?
For me personally, I think families are really interesting. They're just a critical part of all of our lives. Everyone grows up in a family. And so how do people make decisions about childbearing? And what are the constraints they face? And when they have children and how many children they do have. So for me, that's always been inherently interesting. And I started my career in doing research and questions along those lines. And then as I later maybe came to appreciate how important restrictions on access are, I came to study that more and more. But also I would say there are a lot of economists, well, not a lot. There are a good number of economists who are studying reproductive healthcare access because it's an economic issue. So there's a very, very rich and extensive literature showing that reproductive healthcare access, it shapes people's economic lives as well.
And a bunch of economists submitted a brief in the Supreme Court, which you also signed in the Dobbs case. Fortunately, it wasn't, many things were not persuasive to the court, but it was good to have it there and for having to people to realize that, I always think the issue of reproductive health care generally and abortion rights specifically have become so politicized in the US that people think it's a political issue. Yeah. But in fact, it's not a political issue. It's a health issue. Mm-hmm. It's a family economics and community economics issue. And the more we're able to talk about it from different directions, the more important it is. It is not a political issue and should be outside of politics. So the data that you've seen, we wanted at the Center for Reproductive Rights to put some faces to this data. And so we've just issued a report called The Price of Safety. And I think there it is. Mm. And these are some stories that represent people who have borne the economic impact, many times moving out of states because of abortion bans. But I did want to highlight one story and you can get this on our reproductiverights.org is our website. And so you can go and read the stories here. They're short, but to the point of how people are impacted. And one of the people who's profiled here to bring another man's voice into the conversation is Chris Webb, and he's the CEO and the founder of Chow Now, which is a online food delivery platform. And it's a nationwide company. And so as soon as Roe versus Wade was overturned, he knew that he had employees in all 50 states and that a bunch of them really, really, really soon were going to be impacted by the abortion ban. And so here's what Chris said about that, a part of what he said in this report. He said, I sent a company-wide email sharing a personal story. Many years earlier, my then girlfriend and I made the difficult decision to have an abortion. My life would be very different, and Chow Now wouldn't exist had we not been able to make that choice. So he's emailing this to his nationwide employees. I told employees I believe then and now that women should have complete control over their bodies and their lives. And I made a commitment. If anyone at Chow Now needed to travel for abortion care, I would personally cover the costs. So it's a wonderful example about somebody who recognized immediately that it was going to have economic impacts on his workforce and more than that. And we had hoped to have Chris come and talk to you today, but he is in London. But he sent a little video. Nice.
Hi, I'm Chris Webb. I am the founder and chairman of a company called Chow Now, which is based out of Los Angeles. When human rights are removed, people feel angry, anxious, stressed, and a number of other really, really strong emotions. And so as leadership, if you can stand up and be empathetic and explain your thoughts on this, it can help reduce a lot of those feelings. And so it will help get better work done. If your team is stressed, you're not going to do well. If they're angry, if they're anxious, it's really hard for anyone, myself included, to be good at your job. Companies should be more vocal, should be more empathetic, and frankly, just speak out when they see something done that frankly is in line with human rights being removed. As Americans, it's an awful thing, and it's unfortunately played out the last couple of years, and hopefully we can reverse it. Hi, I'm Chris.
Hi, Chris. Thank you. Glad to have you here. So this is a conversation about men and their place in the discussion about reproductive health and rights. And so, let me ask you, and maybe I'll start here with you, Charles, and others can join. What do you say to men that might feel like, I'm not quite sure, right, how I get into the conversation in this space? Is my voice really wanted? Should I be more, staying in the background? Like, what would you say to men who are trying to figure out what's my way into this issue that I do care about?
So very, very frankly, what I say to folks is there's only two types of people in this country. Either you are a mom or you have one, right? And so this is everybody's business. And when we talk about the role specifically I think you said something so poignant, Nancy, when we talked about that this is not a political issue, this is a healthcare issue, but this is also a human rights issue. It's
right.
A fundamental human rights issue. And so when we talk about maternal health, specifically around the role that fathers and non-birthing parents can play, we fight this battle on three fronts: education, advocacy, and policy reform. But we talk. I'm a huge proponent for doulas. I'm a huge proponent for addressing institutional racism. I'm a huge proponent for sweeping accountability measures, access to doula care, and all the things that we need to do to improve maternal health care. But the glaringly obvious piece of this solution that is left out of the conversation is the role that fathers and non-birthing parents can play, right? So because of that, a huge part of our theory of change is that if we can educate and empower a new generation of fathers to understand what questions to ask, how do we advocate, what's the difference between a doula, a midwife, and an OBGYN? What does an integrated care model look like? Understanding how our own health can inform the health of our child. So we developed something specifically called For Cure for Dads, which is a free online app that's available for anybody across the country. And it has a curriculum that takes dads through and supports them through the entire birthing continuum. Also gives them information about the overall broader fight for and the importance of reproductive health across the board. And so I think that for us also, the reality is that as men, oftentimes we don't understand our privilege and how it's extremely important for us to leverage that privilege on behalf of things that are commonly classified as women's health issues when we know it's not a women's health issue. It's a fundamental human rights issue. And so I think that's the big thing, is that I've really tried to always be, I don't even like the word ally, because I think that ally just shows that I'm kind of here with you. I think partnership is really what we need, meaning that I'm all the way in. I'm just not here. I'm here for the ups, I'm here for the downs. And always understand that you are uniquely situated to be the foundational support for your system and the people in your community and everybody in your ecosystem. And so we have to have very, very informed conversations about how we show up as men, about what it means and how important it is. So we just really have to continue to show up and understand that this fight belongs to all of us.
Attorney General, how do you think about this question of men coming into the conversation?
I think that when we're confronting any issue as a society, where something is unfair, rights are being taken away, something that should be accessible to all, that should be a human right, is being restricted, everyone should care. And so we need straight people to care about issues that impact the LGBTQ plus community. We need men to fight for issues that impact women and women's healthcare and reproductive healthcare. We need white folks and all folks to fight for racial justice. It is a misunderstanding and I believe a false position to say that those who bear the brunt of the wrong are the ones who have to cure it and fix it. We all should, because we all should care about it and fight for it. And so what you were saying about men being maybe cautious or hesitant, I don't mind that so much. But I do want every man to know there is a role to play. You're welcome in this fight. You're needed in this fight. If we're going to overcome the huge obstacles that we have, we're going to do it together with everyone helping to some degree. Maybe there's a role to play based on your own personal experience, just like it was for Chris. And and I love the corporations that take positions that are strong and value-based. A lot of them won't and say, we're going to lose half of our clients or our buyers if we do, but there's right and there's wrong, and businesses have a role to play. And maybe there's someone you loved or someone who suffered pain or injustice and you want to fight for them, or maybe you just feel compelled. But I think it's important for men to listen first, like actively listen, assess the terrain. You don't have to take over. You certainly don't have to, shouldn't displace. Absolutely no mansplaining in this space or any space, but there's a role and we're better when we're working together. And in fact, I think that when, there's a beauty in some of these coalitions when it's kind of like everyone on board and when it reaches a tipping point and a momentum and a critical mass, which you just can't resist, and the change will happen. But it requires everyone to find their space, find their place, identify their role, and that absolutely includes men.
I will +1 to all of that. And with that, we'd actually like to bring into the conversation, if we have folks that have questions for our panelists and want to share with them, we have some time for a few questions. And it's a small group, and so someone's going to need to be brave and take the mic. In the spirit of, we need all of us to be part of the conversation. So thank you. Thank you for being brave and coming up.
I don't know that this is revolutionary because I work in women's health, but I am Lauren. I work at the Gates Foundation and I'm a senior program officer for women's health. And my portfolio includes maternal and newborn health, as well as family planning and access to contraceptives, and then upstream innovation and R&D as well. And one of the things that always strikes me about spaces, I'm just gonna check there really quick. Yeah, spaces like this and others is that we're usually surrounded generally by people who agree with us. And I have such a hard time figuring out in my own conversations, but I think also in the work that I do in advocacy and policy is like, how do you have a conversation with someone that disagrees with you? And how do we bring conversations like this one that are so valuable to a different audience? And so I'd be curious to hear all of your perspectives if you've, especially being men, if you've had conversations that have been more difficult, or if you've had to navigate that kind of rocky terrain of discussing this with someone who really doesn't agree with you on principle, and if you have any successes that you've encountered along the way.
Love that question.
It's a great question.
I'm going to have each of you answer it because I know you all have a thought on this one. Charles, you want to start?
Sure. So I think for me, the biggest example that I can point to of having these conversations is for policy. So one of the things we spend a lot of time on policy, both federal and the state level. We are going to be introducing next week a bipartisan package of bills called the Momnibus, right? And it's 13 different bills addressing the maternal health care crisis. And hopefully once it's done, it will be the most sweeping package of legislation that will hopefully move us towards our goal of zero preventable deaths in pregnancy and pregnancy-related outcomes. So for me, one of the things that I do is I make it a point to broaden the tent and help people understand this. I don't care if you are with the Republican Party, the Democratic Party, the Tea Party, the After Party. I don't care. how you identify politically, right? There are two types of people in this country. And so collectively, us, the we that believes that mothers and babies deserve better are the largest constituency there is, right? And so do you want to get on board this legislation, or do you want to explain to your counterparts, to your constituents, why you just don't believe that mothers and babies are priority, right? So that's one place. Like, that's kind of my heavy-handed approach, right? The other thing is that the other way I do it is I say, hey, look, I know that this is tough, right? This is the most politically divisive climate of all of our lifetimes. Wouldn't it be great to find something that's uniquely unifying in a time that's so politically divisive, right? And offer this as a solution for you to find common ground. One of the things that I was proudest of is during the last Congress, we introduced a piece of legislation called the Dads Matter Act, right? And it was a coup because my two Senate co-sponsors were Marco Rubio and Senator Warnock, right? To get those two to come together on something in this climate is an opportunity. Now, I understand that there is a difference between this and the fight for abortion access. And I understand that that's far more polarizing. But I think that when we talk about finding common ground, that's what we really have to do. And I think that the more you talk, and I think also being able to talk to them and find the humanity in them, right? And I think that's why it's so important to center the lived experience. Because at the end of the day, when we talk about the individual stories, which is why I'm so glad that you all put out that report, because it takes it beyond the data, right? When somebody like Chris tells his story, that's how people are able to find the commonality, and they can see themselves. They're like, they may think that these people who are seeking abortion access, they have these preconceived notions about who they are and why they're seeking it. But when they hear stories from unique individuals, because all of our journeys are different, but at some point or another, these people have needed access to sometimes very critical, whether it's life-altering or life-saving healthcare. And so I think that, once again, the ability to find the humanity and the connectivity in our individual stories is a huge way to kind of bridge those gaps.
I mean, 100% on all that. And I think, first, I'll just recognize what we all know to be true. This is a very polarizing moment in our nation's history. This is, although it shouldn't be, a very political issue with hardened positions on both sides. And how do you thaw that freeze and get people out of their extreme polarized positions? And I think a lot of things Charles said are what's true. Storytelling is super important. The more people who are able to tell their stories and share them, I think it connects us. We see that this is a human issue that crosses class and race and politics, and it's something that impacts all of us because it's about access to healthcare, it's about choice, it's about freedom, it's about autonomy, it's about choice about our own bodies. And the more people from disparate and diverse perspectives that share that, I think important, because there are preconceived notions. And so dispossessing people of their stereotypical views is really important. And stereotypes, fear, anger, scapegoating are unfortunately like pillars of politics right now.
Yeah.
Though politics is emotional, fear and anger are strong emotions, and people peddle in misinformation and disinformation to push someone to a certain place. And so trying to be a truth teller and a truth seeker and telling true facts and evidence. I don't think there's anyone who would think that it's okay for a Black mother to be, or recent mother to be told that the pain they're telling you they're experiencing, they're not experiencing. Or to tell them that even though you feel you're in pain and you want some help, you're just looking for drugs. You're drug seeking. Both things happened to my Afro-Latina wife in an emergency care visit, and it's wrong. It should never happen. We have to acknowledge that it does happen. And I think when people see the stats that women of color are so harmed and so impacted by implicit bias and the maternal health crisis, I just don't see how anyone could think that that is okay and should exist. And so sort of killing them with kindness, with facts and evidence and data and stories and humanity, despite our rigid positions in this country, we, I think, agree on probably 90% of the things.
Yep.
We want safe streets. We want good schools. We want quality, accessible healthcare. We want a planet for tomorrow. We want to raise our families and have our kids have a better life than we had. We want a good job. We want economic mobility and opportunity. We agree on all that, but we talk about the 10% of the things that we don't agree on way too often. And I think if we try to really find those places of common ground, we can find them. But you have to seek common ground and want common ground to find common ground.
Very true.
And so those are some of the things I think that have been successful and can be successful as we go forward.
Jason, academia is supposed to be a place where people can't hide in their silos or their group, but they're contesting ideas with each other. So give us a view from academia. Is that accurate?
Definitely. I mean, I would say I have a unique position here on this panel in that as a researcher and as a professor, I'm not, in the course of my work, advocating. What I bring to the table is evidence. And I feel like it's not my role personally to try to shift anyone's values or tell them what positions they should hold, but I can tell them what the evidence says and allow them hopefully to make use of that information, which may or may not change the position that they hold. And, I teach, undergrads and grad students. And one thing I love to do in teaching students and talking about policy is to ask them, well, what's a position that you hold? And what evidence could possibly change that position? And that I think gets them questioning their assumptions and opening themselves up to the possibility that maybe the position that they hold isn't the position that they need to hold forever. And I personally have changed lots of my positions over my life based on learning new evidence. And I hope that others do that too. And I hope that researchers can contribute to these policies in that way.
Yeah, and this conversation is making me think about, what year was it? Was it 2018 that the Irish people had the opportunity to vote on whether they would take the ban on abortion out of the Irish Constitution? And we had worked, the Center for Reproductive Rights, with Irish advocates for many, many years. We brought some cases to the UN Human Rights Committee and won them about women having to travel out of the country. And the Irish campaign, which was Together for Yes, together, like us, in this together for yes. The fundamental principle they started with is don't ever tell anybody what to think, right? Tell them why you care. And so they, and they had to go door to door and talk to whoever's, behind the door. And so that was what their canvassers were told to do, to go out and talk about why they care about the issue. And one of the taglines they had for the campaign was, a woman you love may need your vote. And so I am always of that philosophy that I don't tell other people what to think. I don't tell them, to change their values. I just talk about why I care about something. And so I think that's, I'm always happy to go into, we get invited less, not we particular, because it is so divided, less and less. I think when I started the Center for Reproductive Rights in 2003, I was much more likely actually to be in audiences that had mixed opinions, on panels with people with different points of view, on television programs, on news programs with people with different points of view. And that's not the way we're sort of set up anymore. So I'm always, if the Federalist Society invited me to come speak, I would be happy to come speak to that audience and to speak to anybody anywhere. I went to the Republican convention in 2016. I'm willing to go anywhere to talk to anybody. We're a nonprofit organization to talk about the issues. Yes.
Hi, thank you for that. Actually, I have a question for you.
Okay.
I'm a founder of a healthcare company in Brazil, a women's healthcare company in Brazil. Bonta is also working with me there. We serve over 10,000 women and have a content platform of over 200,000. So I guess my question is one for you and then for you. When women come to us, because abortion is illegal in Brazil, for those who are not aware, seeking abortion, we can't really help them. Is this just a question? Maybe you have some sort of advice to give us that we can give forward, or maybe not. But if you have, I would love to hear that. And then on the data part, I would love to hear if there is any data or research that would help us talk about how abortion or the lack of allowing for abortion can negatively impact an economy. And we could potentially explain that in our content, newsletters and media and all that. So I guess these two questions.
So answering first to yours, not going to give legal advice here on Brazilian law, but if you connect with me, we have an office in Latin America. And I should have also mentioned, we have a whole talking about people in the private sector who are very committed to this issue. The Center for Reproductive Rights works with over 3,000 lawyers around the world who are dedicated and are part of our network. And so talk to me afterwards.
Yeah, and I would say there's a rich and extensive literature. I mean, in some sense, there have been so many, economists would call them natural experiments, where abortion rights have been restricted, and researchers have studied how does that affect people's careers and their investment in education. And the research resoundingly indicates it's harmful to those economic outcomes. The amicus brief that Nancy mentioned earlier summarizes that literature very well, but I'm happy to follow up and give you other references as well.
Great. We are at do we have one more question? Yes, we're going to take one more question before we close. Thank you.
So hi, everyone. Thank you so much for everything that you shared with us today. I used to work for USAID on family planning and gender equality, and one of the things that we focused on was men's engagement in family planning and reproductive health. And one of the things we were funding before the proverbial shit hit the fan was agency and individual agency, collective agency, and what that means in the context of family planning and reproductive health. And what I was hoping maybe you all could talk about a little bit is, and maybe this is from examples from your personal life or your professional life, but when we think about agency in men, everyone's like, oh, men have all the agency, they're good, like they can do whatever needs to be done. But that's not necessarily the case. And so in the context of communication and being a partner versus an ally who can kind of like potentially stand on the side and say, yes, go forth, I support you, but someone who has the capacity to communicate with their partner about what they want, what they don't want, to go out and advocate. I think a lot of men care, but they don't know how necessarily to do that, and don't want to step on people's toes or feel like their existence is stepping on people's toes. So if you could talk about, what message would you give to young men, middle-aged men, older men about how to get out there and how to use or utilize that agency to do what needs to be done in a partnership, as a collective?
Sure. So I'll kind of jump into this. And so one of the things that that's such a great question. And that was one of the challenges that we were really focused on when we started developing this app, right? Is how do we have these conversations with men? How do we get through to them? Because some of these, even if we try and walk them through it, helping them really truly see their place as an advocate, as a support system, as, all of these things that we hope for them to be, it's still challenging. So one of the things that we did in with our focus groups is it kind of led us to developing all of this, particularly for men, around sports analogies, right? So for instance, when you log into the app, everything, it's not trimesters, it's quarters, first, second, third, fourth, quarter, overtime, right? Postpartum's overtime, right? Everything, preconception is pre-game warm-up, right? And we take it through analogies. So we talk about advocacy, like literally it's wonky, but hey, we try and tell, we need you to advocate. Guess what? You're the fullback. Dad, we need you to block for mom. When you go in, you need to take on the financial stuff. You need to anticipate things, and you need to clear a path for her to score a touchdown, which is a healthy pregnancy, right? And the way that we have done this, and it's simple, it's a little bit corny, but because everybody has these unrealized, dreams of making it to the NFL. But guess what? You can still take this teamwork concept and apply it to your house, right? You can take these dreams deferred, and you can show up. You can show up, man. And so, no, it's been really cool. The way that it's resonated, the way that men get it, right, is we've simplified it, but we also, it's a way to make it fun, right? And take out some of the things that are very heavy about it and make it find connectivity. So that's one of the ways that we've done it. But I think the more that we can also begin to have men share their stories of success and showing up and some of the things that didn't work, being transparent about, hey, this didn't work, and this is how I had to pivot, and this is where I found connectivity, and this is how I was able to effectively communicate with my partner, right? And for us to truly show up as a team.
Great. Any other final thoughts on this? Any other football analogies you want to do?
Can't do better than those ones.
Well, thank you for that. And thank you for that question. It makes me think about the fact that in sub-Saharan Africa, there's been all kinds of work on getting men engaged, including through soccer clubs and all kinds of things on issues of family planning. And so we have a lot we can learn if we just opened our eyes and looked around the world for successful things that have been done elsewhere, because all the answers are not here. I want to thank our panel so much. I want to thank all of you for being here. If you want to know what to do, we have a few things up here that you can amplify your stories, use your influence at work, and in every circle that you have, talk to everybody, but particularly, tell some guys about this conversation that you've heard today. So thank you. And again, you can check out the report from the QR code. Thank you to our panelists.
Thank you so much, Nancy.